Good afternoon and welcome to Downing Street for today's coronavirus briefing, and I'm joined by Deputy Chief Medical Officer Professor Jonathan Van Tam and Dr. Jenny Harries, the Chief Executive of the UK Health Security Agency. I'd like to update you on what we're doing to fight the virus both at home and abroad. First, turning to what's happening here in the UK. I'll ask Professor Van Tam to set out the numbers and the details in a moment. But overall, hospitalizations and deaths remain very low, meaning that we've been able carefully to take away more restrictions this week as we've taken step 3 of the roadmap. But we must proceed with vigilance and everyone taking personal responsibility. We've always known that one of the things that has the potential to knock us off track would be a new variant. That's why we made the presence of a new variant that could do that one of our 4 tests when we set out the roadmap, which is the tests we must pass before going down each step of the roadmap. The early evidence suggests that the B1617.2 new variant, first discovered in India, passes on more easily from person to person than the B117 variant, that was first discovered, of course, in Kent. But as the Prime Minister said at lunchtime, we have increasing confidence that the vaccines are effective against it. That means that our strategy is the right one, to carefully replace the restrictions on freedom with the protection from the vaccine. What it means is that it is even more important that people get vaccinated. As I've reported to the House of Commons, there are now 2,967 cases known of this variant in the UK. And we are determined to do all that we can to ensure this new variant doesn't put our recovery at risk. So we've acted fast to guard the gains that we've made together. We now have an incredibly sensitive biosecurity surveillance system here in the UK. And I'm going to set out a couple of new details about that in a moment. This surveillance system spotted the cases in Bolton and in Blackburn early, and through surge testing and increased vaccinations, we're throwing everything at it there. The weekly case rate in Bolton is now 283 per 100,000, and it's doubled in the last week. There are now 25 people in Bolton Hospital with COVID. The majority are unvaccinated. Nearly 90% have not yet had 2 vaccines. This shows the importance of getting vaccinated, not once, but twice. So when you get the call, get the jab. Almost 14,000 vaccines have been given in Blackburn and Bolton since Friday, and over 26,000 doses have been given in the last week, the highest weekly total in these areas. We've also surged testing and delivered 75,000 extra tests to these 2 areas, and we're using 12 testing sites and a 100-strong team going door to door. But these are not the only areas where we have a cause for concern. We're seeing other cases where rates are rising and where we need to act fast, as we have in Bolton and Blackburn. We know that this playbook that we're using in Bolton and Blackburn worked in South London against the South African variant, where we had a series of cases of the South African variant, and we brought that under control. And we've used our extensive surveillance system and new techniques to identify the areas we're most concerned about. We, of course, look at the number of cases, we look at the number of identified variants, and we look at hospitalizations, and we publish all of these data. But we're now also able to use 2 further tools. Mobility data shows travel patterns in different areas, and we look at this in deciding where the virus is at risk of spreading. And next, we also analyze wastewater in 70% of the country, and we can spot the virus and the variants in the water. And that can help us identify communities where there's spread. As a result of all this analysis, we're now surge testing and increasing vaccinations in Bedford, Burnley, Leicester, Kirklees, North Tyneside and Hounslow in London. And we're also supporting the Scottish Government, who are taking similar action in Glasgow and Moray. What this means in practice is putting in more testing sites, and on vaccinations, making more vaccinations available to everyone who's eligible. And to everyone across the whole country, I'd urge vigilance as we open up, and of course, as soon as you're able to get the jab. To everyone in these areas, please exercise caution, get a test, and as soon as you're eligible, get the jab. As we carefully replace this shield of restrictions with the sword of the vaccination program to give us protection for the long term, we keep driving the vaccination program as fast as we can. I'm delighted to say that as of midnight last night, 7 out of 10 adults in the UK have now had their first dose. That's 7 in 10 people who have a big degree of protection against the virus. I'm also delighted that almost 4 in 10 have had the extra protection that comes from having 2 doses. And I'd like to show you a chart which puts this into context and shows this protection across the country, and also to help explain why we've taken the decision to change our dosing interval from 12 to 8 weeks for the most vulnerable. This chart shows the proportion of people who've had the jab according to age group. Green bars represent people who've had 1 dose, blue bars represent people who've had 2. And as you can see from the amount of green, uptake of the first dose has been phenomenally high. And we followed the strategy of getting first doses to as many people who are vulnerable to COVID as possible, as quickly as possible. And for that, read the over 50s in particular. Now you can see the very, very high uptake rates, and we're incredibly proud of how much people have stepped forward. But there's still a little bit of a gap between the green bars and the 100%. And what the experience of Bolton shows is it's incredibly important that we get vaccination even to the final few percent and encourage that take-up. And then the blue bars show the second doses, and we can see that the uptake of the second doses has been incredibly high too. But again, there's a little bit of green showing, and we need to get the blue bars, the second doses, up to everybody who's had the first dose. And of course, as you go down the age range towards the left of the chart, fewer people have had 2 doses because it has been less time since they had the first dose. This is why getting the second dose in to those who are most vulnerable to ending up in the hospital and dying of the disease is so important. Academic studies have shown that this decision to have 12 weeks between the first 2 doses has saved around 12,000 lives. But that uptake, those figures are not yet 100%, and we will not rest until we get them there. And crucially, this acceleration now of second doses for the over 50s, for the most vulnerable, is all about getting the maximum possible protection for those at greatest risk. And while we deliver on the first and the second doses, we're also working on our booster program too, and I just want to update you a little on that. This is all making sure that the vaccines stay ahead of the virus. This includes new vaccines specifically targeted at variants of concern. I'm delighted to be able to announce a new clinical trial backed by £19 million of taxpayers' money to look at the use of current COVID vaccines as booster vaccines and to see what combination and what part they can play in keeping us safe for the long term. And you can sign up to be part of this trial on www.covboost.org.uk. This will be the first clinical study in the world to look at the impact of a booster jab. And I'm very pleased that we're leading the way with this scientific endeavour, just as we have done so many times in this crisis. Take, for example, the huge advances we've made in genomic sequencing. Today we've published our Genome UK implementation plan for how we can build on this genomic science even further, including our commitment to sequence 1 million whole genomes. And I want to thank all the scientists and all those at Genomics England who've been involved in delivering this, which has also, through their genomic work, played such an important part in our tackling the pandemic. Genomics saves lives. We learnt that through this pandemic so clearly, and I'm determined that the UK stays at the forefront of this scientific endeavour as well. We're not just focused on the effort at home, and so a few words about how we're working to protect people all around the world. We've donated over £500 million to COVAX, which has now discovered life-saving delivered life-saving COVID-19 vaccines in 120 countries and territories. But, and I really want to stress this point, over and above our cash commitment, the UK has probably done more than any other nation to help vaccinate the world's poorest. And that's thanks to the gift to the world of the Oxford AstraZeneca vaccine, which is available at cost, no charge for intellectual property. We invested, the British government, Oxford University and AstraZeneca, the three of us, we invested in the research and came together to develop and deliver this vaccine at cost for everyone. And for context, in terms of the scale of the impact of what we've done here, almost 1.5 billion vaccine doses have now been injected across the world. More than 400 million of them have been the Oxford AstraZeneca vaccine. And in total, the Oxford AstraZeneca vaccine has been now delivered in 160 countries. 2/3 of this 400 million doses, 2/3 have been injected into the arms of people in low and middle income countries, including, for instance, 170 million in India, where they've been obviously so badly affected by this virus. And of the 67 million doses delivered through COVAX, over 65 million of them have been the Oxford AstraZeneca vaccine. This vaccination programme is a vaccination programme for the world using the Oxford AstraZeneca vaccine. It's something every British taxpayer has had a part in supporting, and everyone in this United Kingdom should be incredibly proud of it. Rather than changing the rules, as we got many jabs into arms right across the world, we just got on with delivering this at cost without any profit. And I want to thank the team at Oxford and at AstraZeneca for the incredibly progressive and forward-looking approach that they took over a year ago now to set this up. And it is having an impact everywhere. So just as we fight the virus at home, we'll stand side by side with other nations across the world. And I just want to add one more thing, because if this pandemic has taught us anything, it's taught us that our health is intertwined together. Next month, I'll be welcoming health ministers from G7 nations to Oxford, the birthplace of this vaccine that saved so many lives. And there we'll hold the G7 Health Ministers Forum, not just to talk about how to fight this pandemic in the here and now, but how we need to emerge stronger, healthier and safer with the great democracies of the world working together. This, after all, is a virus that attacks all of humanity, and it calls upon everyone to step up and think about what we can do. And you can play your part in that too, in the same way that everybody has played their part so far. So please remember the basics: hands, face, space, and fresh air. And even as we take these steps together, get your rapid regular tests, and when you get the call, get the jab.